Welcome to this week's Interactive Virtual Experience, or IVX. I'm Dr. Mike Mayers, the Director of US Advocacy here at Johnson & Johnson Vision. I'm thrilled to take the helm as moderator this evening, giving Dr. Kurt Moody a well-deserved break. We're grateful to have you with us as we continue our series of peer-to-peer discussions on practicing during the COVID pandemic, sharing best practices from one OD to another. At Johnson & Johnson Vision, we're committed to being your partner of choice. We're making lenses unbeaten in comfort, provide robust practice solutions to accelerate growth, and we lead the fight to protect you and your patients. This evening, we will focus on our advocacy efforts in reference to the new FTC Contact Lens Rule. I'm excited to have Dr. David Cockrell from the American Optometric Association here along with us tonight, and Dr. Trevor Fogg, a practicing optometrist who will provide some ideas on how you could implement these changes into your office. I'm sure you have a lot of questions about what this means for you, and we want to answer them all. But before we start, I want to go through a little bit of housekeeping. Through the discussion tonight, you can submit questions. Just click on the Q&A icon at the bottom bar and submit your thoughts. We'll have stopping points throughout this event. We'll answer as many questions as we can until the end of the session. And if we haven't answered them all, we'll certainly collect them and try to get them answered to you through future communications, such as through your sales rep, or even directly through me, as I'll provide my email address at the end of this presentation. So you can have a direct line to me. In the past webinars, the chat traffic has also been active, so feel free to continue to use the chat module to share comments with other attendees. Just make sure that you select all panelists or attendees to share your thoughts with everyone. And just to reiterate, if you do have a question, use that Q&A icon to submit your question. We have received a lot of requests for recordings of previous events as well. Recordings of the first 6 interactive virtual experiences are now live on jnjvisionpro.com, and this one will be added very soon. If you go to the chat, you'll see a link for where it will be posted. Great, now let's get started. First, I would like to introduce to you Dr. David Cockrell. Dr. Cockrell is the Advocacy Chair of the American Optometric Association, and we're very lucky to have him with us tonight to share his perspective as someone who deals on a daily basis with policymakers and regulators. Welcome, Dr. Cockrell.
Thank you very much, Mike. It's a pleasure to be here.
Looking forward to it. And Dr. Cockrell, I just want to personally thank you for all your time that you dedicate to really giving back to the professions, just as coming on events like this. And just to set our audience panel or our audience expectations for tonight, we're only going to have you for about 30 minutes. And unfortunately, you have to drop off due to other commitments that you have with the AOA tonight, and we completely understand that. And so for the audience members out there, if you do have questions specifically for Dr. Cockrell, make sure that you submit those in the Q&A. And we're going to stop about midway through and make sure that we can get any questions that you have for Dr. Cockrell answered before he needs to sign off. So just wanted to let everybody know that. Second, we're also grateful to have Dr. Trevor Fogg joining us this evening. Dr. Fogg is an optometrist from Cockrell, California, where he runs a private practice and was awarded Best Eye Doctor in the county for 4 years in a row. Hi, Dr. Fogg.
Hi, Dr. Mayers. Thank you for having me. It's a pleasure to be here tonight.
Oh, thank you, and thanks for coming on and joining us tonight. It's been a pleasure working with you so far on really getting prepped for this, and I know you got some exciting things for the audience tonight to share with them. So with that, let's just go ahead and go to the next slide here and keep working through the presentation. So with that, I just want to kind of set expectations. Just real quick, is there a poll question that we wanted to ask first before we jump into the slide? Or do we want to keep going? There we go. Let's jump into a poll question before we get into the agenda. For all the audience participation members out there, select 2 of these that you think is the correct choice. So we're going to put you to work a little bit for a minute. Which 2 federal agencies regulate contact lenses? And choose from 2 of the 4 selection below. Great. Well, let's go ahead and see the results. Oh man, we got a great audience tonight. Everybody is on it today. So Yes, you are. We have 92% agreements and 93% agreements. That is correct. So as my 30-second elevator pitch goes, as the Director of Advocacy, contact lenses are regulated by two federal agencies, one being the FDA for safe and effective use for how patients or consumers use them, and the other one is the FTC or the Federal Trade Commission for how consumers purchase and access their contact lenses. So the other two, CDC and Homeland Security, they don't necessarily regulate contact lenses, but if everybody was, last week was the Contact Lens Health Week that the CDC sponsors, and then also the CDC really monitors public outbreak or safety issues if there is potential adverse events that's happening greater so than in the normal population. So they'll definitely step in and work with federal agencies there. And then Homeland Security also works with federal agencies on potential if there's counterfeit, specifically counterfeit medical devices such as contact lenses coming into the border. Recently, I want to say a couple months ago, they actually just passed some new legislation that gives Homeland Security and the FDA additional authority to destroy like small batches of counterfeit medical devices, and that would include contact lenses as well. So just so you know, a little bit of history on some other the agencies that are working behind the scenes besides the two main ones that regulate contact lenses. So for tonight, the agenda is really going to be around a quick overview of the history of contact lenses or the contact lens rule. What's the prescriber updates? What are some of the EHR, electronic health record adoptions, and what many practitioners on the line tonight may be using electronic health records, and Dr. Cockrell will speak a little bit about that. And then Dr. Fogg will talk a little bit about how he's adopting it into his practice. And then I'll wrap up with some seller updates as well. And as I like to say, many of us may be prescribers, but we also may be sellers too. And so we need to kind of know what's going on from the seller side as well. With that, let's go ahead and jump into the history of the timeline here and kind of maybe rewind and see a flashback in history here. So a really busy slide, a lot of words here, but let me just condense it down into, in 2004, basically Congress enacted a law that was called the Fairness to Contact Lens Consumer Act. So if you were practicing that time, and I was actually practicing as well, just barely graduated from the Ohio State University College of Optometry and was just got my practice license in Ohio. I was practicing at that time. And really basically what that act said was that prescribers need to issue a copy of the contact lens prescription at completion of exam, and then it basically said how sellers need to verify the prescription to make sure the patient gets what's prescribed by the optometrist or their eye doctor. So when Congress passed it, they basically said, okay, which agency is going to now enforce this? And when they looked at it, they said, this is a competition issue, so we're going to give this to the Federal Trade Commission to enforce. So that's called now the statute, which is now the contact lens rule that is the statute. Fast forward 10 years, which is every agency kind of brings different statutes back up for review to see how the marketplace has changed, how has technology evolved, and how has consumers and patients and different industry people interact with the rules. So they opened it up. Johnson & Johnson was very active throughout that process from 2015. I would say it was probably one of the longer rulemaking comment periods that we know of in history, over 5 years. But, there was 2016, they issued the proposed rulemaking. 2017, there was a comment period that Johnson & Johnson provided comments on. 2018, there was a workshop that many optometrists, such as Dr. Cockrell on the phone, attended as well. And 2018, there was another comment period after the workshop. 2019, they issued a supplement to the original notice of proposed rulemaking. There was another comment period. And then finally, in 2020, the FTC announced the final rule. On August 17th, the rule was published to their Federal Register, which means basically once it's published to their Federal Register, there's a 60-day window to which it goes into effect. And so October 16th of 2020 is when this new rule will go into effect for both prescribers and sellers. However, Dr. Cockrell, I'll turn it over to you if you have anything else to add to this timeline, or if you want to say a little bit about this new rule going into effect.
Thank you, Mike. Just a little bit about the timeline. The reason that from the implementation from 2015 to 2020 is really due to the significant effort of industry partners like Johnson & Johnson and all of the ODs in the country who helped the AOA contact our federal legislators, both senators and representatives. This is the first time that a proposed rule has taken 5 years for implementation. And as you can imagine, it met significant resistance, not just from us, but also from the Academy of Ophthalmology as well. But the reality is, with the help from the AOA members contacting our federal representatives, that's what slowed this process down. It's a truly flawed process, as all of you know on the phone. And it's been expanded to the point it is mainly because of input by federal sellers. This process started with actually a testimony by me to the US Senate back in 2015, and then has moved forward, and the AOA's met with the FTC at least a dozen times in the last 2 years, and over the last 5 years, I'm not even sure how many times we've been to Washington to meet with them in person. They've been, to say the least, recalcitrant in listening to us, although it's taken them a long time to put this into effect. I don't want to repeat this because I know we're short on time, so let's move on, Mike.
No, that sounds good. Thank you for those comments. And I would agree with this new, rule that they definitely made important clarifications, but they definitely missed an opportunity as well. And so, let's move on to the next visual here and talk a little bit about what sellers have to do and where, Johnson & Johnson Vision stood. And what do you have to do starting October 16th or potentially maybe later, and we'll talk about that here in a second as well. So first off is really, one of the key topics was around manufacturer inclusion on the contact lens prescription. So, one of the things was, does a manufacturer or brand have to be part of the prescription? And, Johnson & Johnson as a manufacturer of contact lenses, we really advocated to educate different lawmakers and regulators on the importance of, brand and manufacturer, because we know that, every brand is different, and we know even the same material across different manufacturers can have different outcomes on patients. And we don't want to see a negative outcome or an adverse event, happen to our patients and consumers that we serve. So, the 2020 rule actually did continue to preserve manufacturer and brand as a key element. So we were pleased to see that, and there's no change from the original contact lens rule there. The second thing that we also heavily advocated for was prescription expiration. So once again, Johnson & Johnson reiterated the importance of the 1-year prescription expiration date, and the FTC continued to keep that 1-year prescription expiration date. So once again, that's no change from the original 2004 contact lens rule. However, just a note here, depending on which state that you do practice in, just consult with your state board for your minimum and maximum contact lens prescription expiration dates there. So that it can be a little different by state. And then finally, this is probably the biggest change, and as Dr. Cockrell will talk about, and the AOA, it does require additional burden. And during this time of COVID, this may not be the best time to maybe implement this on October 16th. And I'll let Dr. Cockrell talk a little bit about that here as I get through this slide. But confirmation of prescription release. Basically where we stood was we're a top-level member of the Healthcare Alliance for Patient Safety. And as I say, it's not about individual voices, it's about individual voices plus this collection of voices. And just as Dr. Cockrell said, it was this collection of voices of everybody on the phone that were contacting their federal representatives to talk to, how this is going to impact you and your patients. We also, worked through a collection of voices called the Healthcare Alliance for Patient Safety. And what we really asked them to do was implement a less intrusive means to educate consumers, such as just posting signage in the office that consumers or patients are entitled to a contact lens prescription at the completion of the contact lens fitting. And so what the FTC did in the final rule outcome is they actually pulled back on their initial proposal that was more onerous. Instead, they added flexibility around the requirement for obtaining this prescription release, such as digital portability. And so, and as of, June 23rd, as I mentioned, APS, and I know Dr. Cockrell will talk about this, we've asked Congress to delay this implementation of the new rule, which would include signed acknowledgement. So as a prescriber out there, what do you have to do? So I would say the first part, a key indication or delineation is prescribers that do not have a direct financial interest or indirect financial interest in the sale of contact lenses are exempt from this new prescription release requirement. So by federal law, you still have to give the consumer or patient a copy of the prescription. You just don't have to obtain that signed acknowledgement that they received it. Now, if you do have a financial interest in the sale of contact lenses, you have several options to implement, and I'll review those on the next slide here. The other things that we just wanted to point out to our audience tonight that are notable, if the patient does refuse to sign that confirmation statement, just document that. Once again, always go back to our medical legal classes, document. So just document that the patient refused to sign that signed acknowledgement form, and you'll be covered there. And then finally, the FTC rule, the language is a little bit gray on, if a patient requests a copy at a different time, how soon or how quickly do you have to provide that copy? And so they just clarified that and basically said, if a patient or a designated agent asks for the copy, and this is outside of, a prescription verification request for an actual order, if they're trying to, verify, hey, a patient's trying to order contact lenses. This is outside of that. This is just, hey, I lost a copy of my prescription. Can I get a new copy? You basically have 40 business hours to honor that request. So, Dr. Cockrell, anything else to add to this? I know we want to get to kind of the versions of how to administer the signed acknowledgement.
No, that's a great synopsis. The thing I want everyone to remember is that this was a 10-year review that took 5 years to implement. It's possible that in 5 years from now, another 10-year review will take place. And some of you have may seen the FTC's comments at the end of this. And one of the things that came up in a meeting this past weekend with the U.S. Attorney Generals across the country is still the advocation on the part of at least some of the big retail online sellers is that there be no need for any written prescription. And you may have seen that one of the FTC commissioners also wrote a letter with that idea in mind. It's taken a significant amount of work on the part of industry, and I'm going to give Johnson & Johnson leadership credit for this, as well as the AOA, to get the changes that were made from their original rule they issued to the point they're at, where there's something that's easier for us to live with. But this challenge is by no means done. There's significant advocacy to remove the brand from the contact lens prescription, and to the words that's being used heavily as genericize these contact lens prescriptions. As Mike intimated, certainly there is no such thing as a generic contact lens prescription. So we're all going to have to continue to watch for that over this next several years.
Yeah, great comments there. And, in that 2018 workshop, Dr. Malvina Edelman, who, is with the FDA, did come out and say, currently there's no generic medical devices, including contact lenses. And, each one is really specific to the individual, right? And that's where the doctor-patient relationship comes in to really decide what's best for that patient. So good points there. Let's move on. We have another poll question coming up. Let's go to poll question number 2. How have you planned to implement changes into your office? So now that if you have a financial interest in the sale of contact lenses and you have to do this confirmation statement, do you have a plan in place yet? Yes or no? All right. Well, let's take a look at the results here. All right. 40% yes, 60% no. So, all right. Well, we have a little bit of work to do on the phone, so that's great. We have some people will hopefully get continued benefit of learning what to do here. So let's move on to the next one here. So if we talk about how to implement this, basically there's 2 different ways, as I mentioned. There's more flexibility around how to obtain this confirmation statement. The first is really a hard copy. So if you still want to deliver this through paper, you have kind of 3 or 4 different methods to do that on. And, I've kind of, it's in that first check mark on the left-hand side. Basically, you can have the patient sign a separate confirmation statement. So basically, and that's, we've provided language down here at the bottom. And I know Dr. Cockrell, you can mention the AOA toolkit that they've put together. There's a sample form there as well. But basically, it's my eye doctor provided me with a copy of my contact lens prescription at completion of my contact lens fitting. A simple statement, the patient signs it, and then that confirmation statement is complete. You can do a separate statement. You can do a prescriber retained copy of the contact lens. So in other words, if you do a carbon copy, I used to practice in an office. The patient got the white copy. We kept the pink copy for our records, carbon copy wise. Just add that statement to it, have the patient sign it. Patient gets, the white top copy. You keep the original. You're good there. Or the carbon copy. And then finally, you can capture it on a sales receipt. So however you want to do it, basically, you just got to get the patient to sign it. You can't put it on necessarily on your entrance forms. It has to be, somewhere else where it's kind of towards the completion of the contact lens exam. So that's been one of the questions that come out. And then finally, you have to keep that confirmation statement on file for 3 years for audit purposes. Move over to the digital side. Really basically the thing here is if you want to, if you're electronic and you're paperless, definitely get that. How can you do that? First off is you need to actually consent the patient into receiving a digital copy. And you need to do that. And actually, when you do consent them, you need to indicate the method by which they're going to receive their prescription, whether it's email, text, or online portal. One of the questions that I've seen come up is, is email HIPAA compliant? Once the patient consents into, basically that electronic transmission, and they know they're going to get it through email, that's basically we're okay there, from what I understand. So once you consent them into saying, hey, I want to receive my prescription via email, and you're just going to send it to me through your electronic health records, and there's some way to do that, great. And then you just have to retain evidence that it was, sent, received, made accessible, downloadable, or printable. So, and that has to remain on file for 3 years. If you don't want to do a paper, consent, for digital electronic, you can actually do a electronic digital consent, a true consent, where, the patient can just type in their name and it's an e-sign compliant that Dr. Fogg will talk about here in a little bit. So those are really the ways to do that. And I want to turn it over to Dr. Cockrell to talk about, I was on myself the AOA FTC webinar a couple weeks ago, and I thought it was great that you guys talked a little bit about some of the electronic health record companies that are trying to update. So, maybe you want to provide a little bit of insight for our audience listeners on that side.
We can. As probably many members of the audience know, the AOA has a entity called AOA More, which is our registry for disease states. And with that, we have quite a few of the larger EMRs that actually participate in that. And right now, currently, CompuLink, make sure I get this list right, CompuLink, Maximize, Revolution EHR, OfficeMate, ExamWriter, iFinity are all working to have their electronic capability up and prepared by the middle of October. I'll say that I hope they make it. That's a pretty aggressive timeline for them to adapt, but they're going to work for it. That'll be significantly easier. One of the things we presented and showed documentation to the FTC is that just the act of explaining this and explaining this situation to the patient, capturing the signature. If you're getting in a paper format, then you've got to scan it in or save it in a box. That's going to take 3 to 4 minutes with each transaction. That doesn't sound like very much, but as you all think about paying your staff for 3 to 4 minutes for every one of your contact lens patients from now on, that's a significant amount of money. We estimated that the actual financial impact to every single practitioner was in the neighborhood of about $18,000 annually. Well, it'll certainly save us some money and some time if we could do it within our EMR systems. And I think they'll all get there. I'm just not certain they'll get there by the middle of October. At any rate, they're all working towards it. The AOA is working with them to make sure their data implements it. I want to second something Mike said. The HIPAA violations are not a concern as long as it's going through the portal, as long as the patient's signed and accessed the portal that way. If you just want to send it without that, yes, then you could have some HIPAA violations. You can also do it through encrypted email, but the patient's then got to have still the encryption key to be able to save that. Again, I don't want to go on too long on any of these, so I could save time for questions, but
yeah.
I guess that's it on the EMR right now.
Yeah, that was perfect. I think that was exactly what we're looking for. And I know just from a time perspective here on housekeeping, we know your time here, you got to drop off. So let's go ahead and open it up for some Q&A. And, I think one of the first questions I see coming in here, Dr. Cockrell, is that if a patient somehow can't pay for their prescription or can't pay at the completion of their contact lens fitting, do you still have to issue the prescription?
Yes, you do. That's changed quite some time ago. If you've completed a contact lens fitting, the patient is still has access to, still has the right to get a copy of that.
Great. So the next question that's coming in is, how have other manufacturers worked with the AOA and J&J on this act? I mentioned the Alliance for Patient Safety. I would say that, AOA has definitely their advocacy initiatives, and J&J has ours as well. So Dr. Cockrell, what would you add to that?
I would say that I'm going to give credit to J&J. They've certainly demonstrated the leadership role in this, and that's done individually as members of the Alliance, as well as just individual outreach. I know that J&J has been very active with individual outreach above and beyond working in a coordinated effort with the AOA, which they've done very well.
Yeah, great. Yeah. We do. Definitely. We do try to do a lot of education, and I'm privileged to serve as Director of Advocacy. Really continuing to help educate. On the safety and for consumers and for patients. Another question here, Dr. Cockrell. I have a sublease at a Target Optical. I do not sell contact lenses or get a percentage of the optical sale. Does this mean I'm exempt from the new requirement?
Not if you're we did check that out. Not if you're charging for the services. If you're actually providing the contact lens service and the fitting, and charging, then no, you're still going to have to participate and demonstrate that you did in fact give the prescription to the patient.
So if you do not, so I think another question that came in, what is financial interest? So if you charge for a contact lens fitting fee, does that mean you still have to do the signed acknowledgement form?
Yes, it does.
Great clarification there. Let's see, let me just, why, Dr. Cockrell, there's another question here, good one. Why is there not going to be just a national database that maintains the information? And I'm not familiar with this, but capital CIRX, lowercase x, number of refills, and the seller would just log in to receive the information.
There is no national database right now. There's a variety of answers to that, but first of all, there is no national database that all ODs have access to. And if you can imagine, we still have, unfortunately, a fairly significant percentage of our ODs who are not EMR proficient at this point in time, and none of the EMR systems currently interact with that particular database that you're talking about. So to build that database would be a massive undertaking that at this point in time isn't going to happen. It's just too expensive.
Yep, great. Thank you for that. The next question is, let's see, what is in the rule that requires the consent to not be allowed in the initial paperwork? So I think I made a comment earlier about, can you just put it in your, entry paperwork that the patient walks in? You want to clarify that maybe, Dr. Cockrell?
Yes, I do. I actually was in the meeting where we suggested that, and we went through, and it was interesting when we had one of the meetings with the FTC, and we brought up the difficulty oftentimes in just getting the patients to want to fill out the entry paperwork and then having to go through an explanation again on the backside of the fitting. Now you've got to sign this. They were concerned that the patients would not understand that they were still supposed to be able to receive their contact lens prescription. And despite our efforts to go the other way to make certain it was in block lettering, to make certain it was at the bottom of any form on the intake form, we lost that battle. They wanted a separate document, so there was absolutely no doubt in anyone's mind that there was a requirement for it.
That's great. Good feedback. I think this kind of, I'm trying to kind of group the questions, but I think, we got a couple of these. So it says, please confirm. If a patient has a fitting and does not pay for the fitting, they are still titled to their prescription, ?
They are. That's not always been the case, but yes, if you've completed the fitting, they're entitled to it.
Great. I think we answered the question around, in my setting, I just do the fit. I do not sell lenses. However, you did say, if you charge for a fitting fee, you technically do need to do this new confirmation release. So is that accurate?
Yes, it is.
All right. What are the penalties for non-compliance, Dr. Cockrell?
Wow. The penalties for non-compliance start at $25,000 per occurrence, and they go up from there. So it is a huge penalty. And the FTC has been very clear that they intend to, their words were, aggressively audit. I don't know what they mean by that, and I wish I could tell you. But we do know that in one of the surveys that was done that unfortunately the FTC cited that was sponsored by 1-800, that's public record, so I can say that, the 1-800 aggressively asked their customers for input and feedback, and then they forward that on to the FTC. So my assumption, it's only my assumption based on my many conversations with them, is that they will take outside input from contact lens sellers or retailers as to where they should aggressively audit. So if they get input from some reseller that a patient tells them, gee, I want to buy my lenses from you, but my doctor wouldn't give me a contact lens prescription, or at that point, there will be an audit done. And I think that they're dead serious about it.
Yep, great. Let's do two more questions because I know we're right up against your time spot here. So first question is, where should I report any violations or adverse events from, illegal prescription substitution?
There's a couple of different places. The APS has a great website, and on that website, I'm going to read that. It's www.patientsafetytoday.com /leaderboard. You can also report it to the AOA at www.aoa.org, and it'll go to our federal advocacy team in Washington, D.C. And when you get on our website, there's a button you can find to actually send that on directly to them. Either one of those, and obviously we're turning all those over to the FTC as the violations occur on the other side.
Great. And I would say to all the listeners out there, please do report. That's one of the things that is we go in and educate and talk to the policymakers and lawmakers is, just having the data to support the argument. So please do, reach out and report that if you see it. And then finally, Dr. Cockrell, does the new FTC rule apply to all patients in which a contact lens fitting is completed, and the patient's orders the contact lenses from our office? Is the FTC still requiring you to give the prescription to these types of patients? So, I guess two parts there. One, do you still have to, does this new rule apply to all patients when the fitting is complete, and that even if they order contacts from your office?
Yes, it does. Yeah, regardless of where they're ordered from, you still have to give the patient the prescription, and nothing's changed from the original rule. At the same time, you still have to have this documented. I want to address just a couple of the things, if you don't mind, Mike, before I go.
Please.
Some of the good regulatory requirements, as all of you on the phone know, we've had robocalls in everybody's office that you couldn't understand. You had no idea sometimes who the patient was or who you were supposed to contact. The retailers must now record the entire call, and they must make it very clear, speak slowly, so that every single person receiving that call knows who the retailer is. They must identify it as a request of a prescription verification made in accordance with the contact lens rule. And this is literally in the rule, deliver the information required in a slow and deliberate manner at a reasonably understandable volume, and make that information available to the prescriber. So they're going to have to record that, which will make a change. Also, a seller may not alter a contact lens prescription in the context of prescription verification. As we all know, that's happened from some sellers, not all. And they've got to speak clearly and make certain that the brand name is maintained. Again, we don't want brands to be switched, or that's not the patient's best interest. And here's one thing that I want all of you to keep in mind. There is a wide body of private label contact lenses. And a seller may substitute that contact lens. If it's a private label, they know who the private label companies are, and they can switch from one to the other. And my belief is, my personal belief is, if you really do believe that a specific contact lens is what you need to properly take care of that patient's health care, you should be prescribing one that can't be switched by some retailer just because they know what a private label is. The other thing the sellers are required to do is they're required to provide a prominent method and a clear and prominent disclosure of that method for the patient to present the seller with a copy of the prescription. In other words, the patient has to give them a written signed prescription. It can't be a fill in the blank on the internet anymore and that be acceptable. I want to make sure those comments are out there. And then I'm happy to answer one more question if you want before I go. Thank you all very much for allowing me to be on this webinar tonight.
Yeah, no, this is great. I'm in the chat now. I came out of the Q&A, but somebody joined a little bit late. But if you give a patient a trial, they will call, and if they did well with the lens, how do we do that? So I think there was a couple different questions around if I give one trial or two different trials, if we haven't finalized the prescription, and then the patient says, hey, I'm ready to order, how do we handle that?
It depends upon how you want to handle it in your office. In my particular office, if I'm dispensing a trial, I'm not really going to approve that contact lens fitting until I've seen the patient back in my office and viewed to make certain it actually fits. And so you have control of when the contact lens fit is finished. The doctor still has control of that. But once you decide it's completed, at that point in time, you're required to give that prescription. The challenge you'll have in that particular situation is if the patient's not in the office, how are you going to get that form signed? And if you don't have that form signed and you're audited, you lose. The FTC has been very clear about that. They're not going to accept I couldn't get the patient to sign it without documentation. So I hope everyone on this webinar will realize that that fit has got to be complete and the patient's got to be standing in your office to make sure you get that signature. The last thing that everyone wants is for any doc to get hit with probably a series of $25,000 per occurrence fines.
Great. Well, thank you for that, Dr. Cockrell. And I'll, once again, just appreciate your time tonight. I know you got some other obligations you got to sign off for and cover off. So thanks again, once again, for all your advocacy efforts and just, for everything you do to give back to the profession. Thanks again for coming on tonight.
You're very kind. Thank you all very much. Thank you. And I'm very sorry I have to run to my next call.
Well, have a good night.
All right. Bye-bye.
We'll see you. Great, and I still see there's Q&A coming in. There's going to be more. We're going to do Q&A here just in a little bit, so we'll get back to your questions. There's definitely some questions I can answer as well and be there. So, but it was great to have Dr. Cockrell on the line to answer some of those questions. So, with that, I think we have one more poll question. Let's go ahead and move to that. So. And, as I mentioned earlier, and we've talked about, which type of method do you plan on implementing? So 40% of you said you already have a plan, 60% said you didn't have a plan to implement or how you're going to implement. How you think you're going to do? So let's go ahead and open up the poll and see what the results are. You can go ahead and let's take a look. Perfect.
It's close.
Awesome. About split, 50-50. 60-40, so good. So that's, I'm not as familiar. I've been with Johnson & Johnson since 2011, and so I'm not as familiar with the number of doctors that are using electronic health records versus still paper records today. But Trevor, does that sound, about right to you, a 60-40 split for doctors that are between paper and electronic?
That sounds about right. It's come a long ways in the last 5 years in terms of people moving away from paper, which is great, but it's not gone. Great.
Well, let's move into the next section, and this is where I think we want to get a little bit of some feedback from you here. If I remember that, yep, that's perfect. So, the patients, or I'm sorry, the doctors and the offices that are looking at, that 44%, I think that approximately that answer the question, they're going to do a digital copy. You want to share with them kind of what you're thinking in your office and how you're going to, administer this when it comes up for, starting the implementation, whether that's October 16th or, a future date?
Absolutely, Dr. Mayers, thank you. And I appreciate the opportunity to share it. And hopefully I can answer some of those questions that were coming through in the chat, because those are all situations that are coming up in each of our practices. So unfortunately, as we've gone over, basically this new FTC requirement requires a signature of receipt of the prescription, not a signature that they are required to be able to take their prescription. So what that's done is, for anyone doing this through the paper route, which generally would be the fastest and most streamlined, is it requires that the patient be in your office at the time that they collect the prescription from you. So it was mentioned to some people who send their patients home with trials and don't always do a follow-up. Maybe unlike the situation that Dr. Cockrell mentioned, it's a situation where they're just trying a slightly different prescription in the same lens that you already know fits. Or maybe in that scenario, you just give them the prescription for that new power, but they call you back in a week and say, you know what, actually, I was more comfortable in the old power. Could I go back to that? They would now, under this, have to come into the office and sign a form for you, stating that you gave them that prescription, even if they were ordering through your office. So there are, in my opinion, that sets us up for some situations where it's not ideal customer service. And it also, in addition to the time for our offices and the value of that, as Dr. Cockrell mentioned, it sets up a difficult discussion. The other portion is, say you have someone checking out of your office and they've said, okay, I'd like to order a year's supply of contacts today. And you say, that's wonderful. Thank you. Let's submit it. Oh, and by the way, can you please sign this form that says I gave you your copy of your prescription? My goal is to try to preempt this. In our office, we use Revolution EHR, and I am hopeful that they will have a really easily integrated system. He mentioned, Dr. Cockrell mentioned a bunch of the providers that offer that. But I'm, in my office, we're planning a way around this. So we're going to encourage that our patients choose to sign a digital consent form. The reason for this is twofold. One, there's a touch-free option, which in COVID right now, we are trying to minimize touch points within the office as much as possible. Secondly, it's the only version of this that allows you to consent the patient in advance instead of after. And the FTC press release on this and their website lists the specifics of this. But essentially, you can, before the evaluation at check-in or wherever it works in your office flow, consent that patient that they will be receiving their prescription from you and that they desire to receive it electronically. The FTC specifically on their website says, now, obviously consult your attorney on this, but on their website specifically, they say that as long as the patient is given the options by which they can receive it digitally and they opt into digital acceptance, and it specifically says email, text, and patient portal. So in terms of the HIPAA compliance side, the FTC has opened up some leniency here again, as far as long as the patient accepts into it. So the concept here is basically at our check-in, this would obviously be a written piece of paper, but the patient would say, you know, my name, know that I'm going to get a copy of the prescription. I would prefer to receive it digitally, and that's going to be via email or text. Now the obligation for us, we do not need a signature on the back end. We only need to attach to the chart proof of our submission of that. So proof of the delivery via text, proof of the delivery via email, or proof of the delivery via portal, rather than acquiring a signature on the back end. So yes, there's a time loss due to that, but it means that if the patient signs up front that they want it digitally, they don't have to be there present at the moment that the prescription's given. If we move to the next slide, the beauty of this as well is we've also, through a link, embedded it in our website that the patients can e-sign this. And the FTC did, as part of this, give us the option of e-signature so that it doesn't have to be in person. So now during this COVID era, every one of our patients receives an email before they come in with a listing of all of our new sort of COVID protocols to keep them safe and our expectations of them as well. And what we will do as part of that email is embed a link where they can go on and actually e-sign that they want the digital acceptance. And then ideally, they'll do it before they ever show up in our office. They don't have to touch a pen. They don't have to touch a piece of paper. And all we have to do is track it on the backside. Naturally, just as a follow-up to this, obviously some patients are going to opt out of this either because they don't want it sent this way or they can't physically. And in those scenarios, we will have to have a paper statement. My plan is to put a second signature line on the prescription so that we sign the written prescription, they sign at the bottom that they've received it, and we just keep a scan in the chart. But again, the problem with that is that patient will have to be present in the office and have that conversation at outtake. So that's my sort of summary of it, and we'll hopefully get a lot of questions later and we can help clarify things.
Well, that's great. Thanks, Dr. Fogg. That was, really good tips, I think, on how you're going to hopefully streamline the process and make it as seamless as possible for, your office personnel and for your patients. So thanks for sharing that with us. Let's move on, to one more. I think, yep, this is kind of I would say, last part of my presentation. As I mentioned at the beginning of the agenda, what is the FTC, requiring as far as new updates for sellers? And actually, Dr. Cockrell, I was going to comment, Dr. Cockrell actually covered off on a lot of this stuff in kind of his closing remarks. I did want to clarify, though, on the private label of that. And so let me talk a little bit about that. And I know Dr. Cockrell commented on private label and that substitution can happen, but there's only specific instances that can happen. So let's talk through that. So the topic and the issue was around prescription alteration and private labels. So, basically private label are lenses that are marketed under a different name, but they're essentially the same lens. So really Johnson & Johnson vision, we stood and educated the FTC to reinforce that, prescription alteration remains illegal. So a seller cannot, modify that prescription unless the doctor has that full oversight to do that. And then we also wanted them to preserve the private label distinction. There were some comments through all the proposed rulemaking that should private label be removed from the language. And we thought it was very important to keep private label, and I'll tell you why in a second. So overall, in the final rule outcome, basically the FTC came out and explicitly stated that altering a manufacturer or brand is illegal. So that's once again a win for patient eye health and safety. We know if a patient potentially could get the wrong brand or manufacturer, material, even if the material is the same across different manufacturers, that could potentially have negative consequences for the patient. So, once again, we believe this is continuing to keep patient eye health and safety in the right spirit. Number two is moving along on that same box there. Substitution is the only permitted when contact lenses are made by the same manufacturer under the same conditions. So as Dr. Cockrell mentioned as he was closing, yes, private label does exist, and a seller can substitute private label, but only when that private label is made under identical conditions, and it's just marketed under different brand names, but it's made by that same manufacturer. So it's the same exact lens. So as long as it's the same exact lens, that patient should have the same experience. But you as practitioners should just know, if you are prescribing private label, the seller has the ability to also change it for another different private label that's made by the same manufacturer, same parameters. So another important clarification there. Once again, around robocalls, this is actually something where we think, believe the FTC missed an opportunity, and let me talk through that. So the overall rule, Johnson & Johnson advocated to, really put more, requirements around robocalls, and if they can't eliminate them, then put more requirements. And so ultimately the final rule outcome, as Dr. Cockrell mentioned, it requires automated calls to be clear, comprehensible, have the option to repeat, and really just it provides that paper trail and essentially sellers have to maintain that call on record for 3 years. So once again, just kind of continuing to create a paper trail and that, and through that audit verification process to make sure that what doctors are prescribing, sellers are fulfilling, and that patient's staying in a safe wearing environment. The other thing I'll note is there is a bill in Congress, it's called HR 3975, that would essentially update how sellers and prescribers communicate, and essentially they would eliminate robocalls from verifying a contact lens prescription. In today's technology world, we believe that there's probably better ways that sellers and prescribers can communicate, and we just really feel that patient health and safety would be emphasized if robocall would be put on a different platform if robocalls were eliminated from prescription verification process. So, and then the final thing is on the seller side, if maybe you own or have an e-commerce website, and maybe patients come on or consumers come onto your website to order contact lenses. If you have an e-commerce website like that, you actually have to update your website as well to what is prescription presentation. So basically what this is, and we supported this, it provides a clear prescription paper trail to reduce sellers' reliance on passive verification and contributes to really a more error-free prescription fulfillment to make sure the patient gets exactly or what's prescribed by the doctor. So basically as the consumer goes through selecting what brand they may have, if you have if the e-commerce website has drop-down menus, basically before it gets to the point where it says what's your doctor's information and can we reach out and contact you or contact them on behalf of your authorization, before it gets to that point, the online e-commerce seller actually has to say, hey, give us a copy of your prescription. You can upload it to us, you can email it, you can text message, any way you would want. But really it's just once again trying to encourage as doctors, we should be giving the prescription to the patient, and then that patient should be easily, can upload it or however to, provide it to the seller if they don't purchase from the doctor's office. So once again, just continuing to provide that clear paper trail and hopefully, making sure patients get, what's prescribed. So that's really it on the seller side. I think we'll go to the next slide here, and I think it's, Q&A, perfect. Let me jump into it here. And I think one of the questions, Dr. Fogg, is, does this apply to gas permeable and scleral lenses?
So yes, it does. All contact lenses need to do this. It is not just a rule for soft contact lenses. And then again, as part of this, the FTC did make clear in this that there are no substitutions. So if it's a scleral lens or a RGP lens or any other type of specialty lens, that prescription should obviously include all of the data necessary to order that lens. Now, naturally, the patient will not be able necessarily to order that lens from all places. It'll need to be a seller of that specialty lens, but it does.
Great, thank you. Let's see, next question here is, and I think this goes back to a little bit to the trial lens process earlier. Do we only have to release the contact lens prescription when we feel that the RX is final, and not during the fitting process? So I think it sounds like it's, during the trial fitting process, if a patient asks for a copy, do we have to, issue the copy or as doctors, and do we have to do the signed acknowledgement form? What would be your thoughts on that, Dr. Fogg?
So it does say at the conclusion of the contact lens fitting. I tried to preempt that question in my statement rather than a completely generic digital acceptance. I actually included a line saying at the conclusion of your contact lens fitting, you'll receive this, and that fitting may take more than one visit, just so that they know in advance that they're not necessarily going to get a prescription after one time in the office. So it is at the conclusion of the fitting.
Great. Good deal. Let's see, a couple questions came in around, can you just send an electronic copy to the patient and then there's proof that it was sent? And I think, another question is, I watched another webinar a few weeks ago, was under the impression that when it comes to digital copy of the RX, you need to have two separate documentations. One, the patient acknowledging that they received a copy of their RX, and two, consent to receive it digitally. Is this correct, or is there just one consent form? So maybe you want to just kind of refresh on, the hard copy versus digital copy, and then if you want to go digital copy, the steps to do that quickly.
Sure. So for both HIPAA reasons as well as complying with this new FTC rule, if you are going to send a prescription digitally, you need a signed digital acceptance from that patient. So they need to write either through e-sign or in hard copy in your office. They need to sign that they are electing to get it digitally, and they also need to tell you which route. That's pretty well specified in the FTC regulation. So the patient needs to say, I want it via email, I want it via text, I want it via the patient portal, if that's available. So if you're sending it digitally, they do have to do that. The FTC then says, if you have that digital acceptance, because you are sending it remotely, there's not a second signature under their requirements that they've accepted it. It just says that you need to retain proof of that submission. So a sent email, a sent text, however you want to document that in as an attachment to the patient chart or keeping a separate log. But you would want visual confirmation of it actually being sent with a date that you can record. But they do not have to sign a second time that they've now received it. You just have to prove that you sent it to their preferred method.
Great. Another question is, once they digitally consent, do you have to get their digital consent every year, or is that good for the 3 years that you have to keep it on file? What would be your thoughts on that?
I don't know that was clear. At this point, my plan is to just to cover my basis and just have them digitally consent each year. But have you seen anything separate on that, Dr. Mayers? Do you have a
Yeah, no,
answer?
I think it's a great question. Once again, I think I would, kind of refer to my attorney in the interpretation of it. But, it just says that you have to consent to, as you just pointed out, which method that they're going to receive the electronic copy. So, once they, I think, consent into that, I would say that that's good for 3 years. But once again, I don't want to provide legal advice. And I would say, to your point, Dr. Fogg, that wasn't clear. So, but a good question from the audience member. Let's see, lots of questions here. Love it. Can we reject an online request for an annual supply if it comes in only with a month left on an active prescription, or a valid prescription is what the FTC would deem it? What would be your thoughts there?
To this point, my understanding is there is no quantity limit. It was something that I believe AOA and a number, Johnson & Johnson, a number of other groups have tried to advocate for. But as of right now, that prescription is valid or not, correct, Dr. Mayers?
That's correct. As long as it's a valid prescription, technically the patient can fill that supply. So that's one of the things that, to what you said, Dr. Fogg, in our 2015 comments, in our original comments, we definitely did mention quantity limits from a Johnson & Johnson perspective. However, we were asked show us the data. So when it comes to the reporting that Dr. Cockrell mentioned earlier, that's really where, the more data we have, if you do see, potential adverse events from, patients wearing contact lenses beyond the expired prescription, if you see, illegal substitution and adverse events, please do report it, because that just continues to, provide that data to provide evidence and allow, these policymakers and regulators to make informed decisions. And that's really what they're trying to do, to the best of their ability as well. So it's a good clarification there. If a patient complains about the inconvenience that we may cause them, where should we direct them? And I'm guessing this would be, if this is written in the in doctor's voice, I'm guessing it's, my patient's going to complain that they're having to do more paperwork. So where would you direct your patients, Dr. Fogg, if they were kind of complaining of too much paperwork in your office?
So again, this is also something that I tried to a little bit preempt, again, rather than going with a totally generic statement. And I would hope that everyone would, again, consult their legal team and come up with their own version of this. But, I tried to make it clear that this is a regulation that applies to everybody, and it's a requirement. Now, if they refuse to sign, as of right now, the understanding is if they refuse to sign the digital consent, then you are required to give them a paper prescription at the conclusion of the fitting. At that point, if they refuse to sign the acceptance of the prescription, then as Dr. Mayers mentioned at the beginning of this, what you need to do is write patient refused to sign, and then you need to sign it and date it and keep that in your file for 3 years. And again, that is the FTC directed, where if a patient refuses to sign, that's the proper protocol.
Yeah, absolutely. And I would just say there's, the FTC website, go on the Federal Trade Commission. There's an opportunity where consumers or patients can, register complaints. So that would be another avenue if consumers and patients are, feeling like this is another, more paperwork, that would be something there. One more question, and then I think we're going to wrap it up. But you're saying that they can e-sign before the exam, yet they can't e-sign after the exam. What are your thoughts on that?
So they could e-sign after as well, but my concern in that scenario, and I think it's something that you should keep as an option. For me, the concern there is essentially there's a lot of back and forth. If you say, yes, absolutely, I'll give you your prescription. However, I need you to e-sign this document through whatever e-sign you choose to use, and then I'll give it to you, because we can't actually withhold the prescription from them. So we would have, basically, you'd be delivering it on faith. You'd have to deliver them the prescription and say, and by the way, I'm required to get your signature with that, and hope that they send it back or have to advocate that. Because so yes, an e-sign after is fine, except that you would then be delivering the prescription without the signature yet.
Great. Well, thanks
for
that
puts
feedback.
You at risk.
Yeah, absolutely. Thanks for that feedback. Appreciate all your insights, Dr. Fogg. And, I just want to wrap it up by saying, everyone's voice is important to us, and we want to continue to stay, connected with you. We'll continue to broadcast these national events, but please reach out to your local representative, because we're also holding smaller regional roundtable discussions where you can speak directly to each other on what matters most to you. Once again, I'd like to thank Dr. Cockrell and Dr. Fogg for taking the time to share their insights with us this evening. Dr. Fogg, just any other closing thoughts?
Well, I'll zip us through these key takeaways, but thank you again, Dr. Mayers, for including me. It's been a pleasure, and hopefully we could clear a few things up for everybody. Also, I would urge you to go look at the FTC website as well, because they do, there are always contingencies, but they make pretty clear what their expectations are. So some of the key takeaways we wanted you guys to leave with are, number one, even now before this, we are still required to give every patient a copy of their prescription. So you should continue giving every patient a copy of their prescription. But now, as of October 16th, we will also be required to have them sign an acknowledgement of receipt. And as you heard from Dr. Cockrell, the penalties for this are too high to not comply. Secondly, as we discussed, I personally believe there are a lot of benefits for all those patients who will do a digital acceptance. I think it frees you up to not run into a lot of these possible other concerns. Third, obviously make sure you maintain the records for at least 3 years. That's what the current regulation requires. And the last one is do report your non-compliance. And if you see illegal substitutions come in, you can report those to AOA or the patient safety database, as Dr. Cockrell mentioned earlier. And this allows them to continue to advocate on behalf of us and our patients. And then once again, it is official. And as of right now, October 16th of this year is the day that this law goes into effect. And so we need to be ready for it.
Great. Well, thanks again. And I know we're up on time. If we didn't get your questions tonight, please reach out to your Johnson & Johnson Vision sales representative. I said I would give my email address at the beginning. That can be dangerous sometimes too, but I'm more than willing to, hey, send me an email. This is glad to interact. So my email is mmayers, my first initial of my first name, and then Mayers, M-A-Y-E-R-S, at its.jnj.com. Please reach out to me. If I don't get back to you right away, I promise I'll get back to you. We'll have a discussion about some of your questions. And then finally, we do have a website where we'll post, some of the slides that you saw tonight. You can go to that website as well. We can put that up in our chat here as we're closing out. And, once again, have a great night, and thanks for joining us in your evening. Have a good night.
Night.